Hi everyone, my name is Ting, Shih, CEO and founder of ClickMedix, which is an intelligent patient management system built out of MIT with a very ambitious goal of improving the health of over 1 billion people. And when we thought about a challenge that huge, we thought we gotta go to just the most rural place with no doctor, no way to afford healthcare, and see if we can make it there. And if we can do that, we have a shot at 1 billion people. So we first went to rural Uganda. It took myself about 8 hours to get there. But for people to go to their nearest clinic, sometimes it's a walk of a day or even 2. But when they get to the clinic, they're waiting in line until they get seen, and sometimes that takes a few days. When they're actually seen, you can see the quality is not very good. So the ClickMedix solution is a software platform that does 2 things. We help manage patients. We're also an expert learning system. Let me show you how that works with one of our very first programs that was done in Botswana to help health workers screen for cervical cancer. So first, we worked with the women's health specialist. We asked her, what are the questions that you need to ask of the patient in order to get some information so that you can make a diagnosis? We create a mobile application that has an interface where you can see, health worker would simply click on an icon of the disease that they need to screen for. They'll enter the patient ID information and then literally just fill out a questionnaire and keep on going and taking a picture of the patient's symptoms if they need to. And in addition to that, it also can integrate with a variety of medical devices. All of these talk to our devices offline so we can deliver the care anywhere. And these include blood pressure monitor, ECG, basically what a health worker could need for an entire full clinic. And after entering the information, it's backed by decision trees that we built with the women's health expert so that it can derive at an accurate risk level. And more than that, we actually can tell where that patient should go for care, and remote experts are available if needed. And then we create a step-by-step plan, not just only treat the patient, but help her manage her disease over time and prevent it from reoccurring. Better yet, all of this feeds into our expert learning system, which you see there. So it gets smarter as you feed in, as you go through more patients. And even more than that, what we're seeing is that these health workers, by the time they've seen the 10th patient with cervical cancer, they themselves are able to diagnose the cervical cancer. And in that one summer alone, our health workers helped save the lives of 96 women. So why stop there? We expanded it to oral cancer. And it was adopted by the government of Botswana because they can save over $1 million per year. And imagine you have a clinic that literally is a mobile device with some devices and a health worker operating it, delivering doctor quality care anywhere, and therefore saving a lot of costs, and patients are getting faster access to care without the long travels. And obviously, why stop there? So since 2011, we're now in 20 countries. We've deployed these systems. We serve over 500,000 patients. We've trained over 1,000 health workers. We've expanded the expert learning system to cover more diseases, particularly chronic ones, diabetes, heart disease, hypertension, maternal health, and a number more. And what is the most incredible for myself, at least for also the public health world, we're identifying patients at large. What diseases are they having? We found a rural area in India that actually has 30% people with diabetes. That's 3 times more than the national average. And we're also working with the data set to start making predictions. We've created an algorithm for predicting diabetes in pregnant women. And therefore, we can actually prevent diabetes from happening in the first place, which can also help the babies. We've been building our expert system with medical experts, such as ones from Harvard and Cleveland Clinic. And they are using our system because they want to extend their expertise to rural areas where they know patients would never be able to see them. We sell our system to health services and governments because they can reach up to 10 times more patients. At the same time, they're getting a 90% reduction in cost compared to building hospitals and facilities. We also work with work sites and insurance companies because they can better care for a population of patients. They pay us a setup fee and a per user per month fee. And in order to scale quickly, we want to start with one of the customer segments, and that's work sites, because they also have a financial incentive to work with us, make their workforce more healthy and productive. And we know we can win in this segment because compared to other digital health programs such as medical records or even AI healthcare or telemedicine, we can take a patient from having a symptom all the way to the right diagnosis, the right treatment, where they should go for treatment in their vicinity that they can afford, and even pair them up with home visits and health workers so that they can get better. And plus, we're the most affordable solution. So to scale up, we're doing 2 pilots. The first one for Worksite is with a mining company in South Africa. Our customer is paying us for that pilot because they have a large population of chronic disease patients that they are sending out to hospitals so that a specialist can actually see them. So we're providing the clinic kit, which is devices and tablet, in their occupational health clinic so that they can screen and even care for these diseases on their own work site. The second one is a workforce that is predominantly women, because we know if we help women get healthier, they will help their communities. And we're looking for grants and partners to start pilot it at a women's work site such as garment or shoes manufacturers. And by proving that there is a significant ROI to helping their employees get better, the employers continue to fund the growth of the program. And we will repeat that to additional work sites. With this plan, we are projected to reach 15 million people by 2023. So will our revenues grow accordingly. We have a team of serial entrepreneurs with expertise in business, technology, and healthcare. We also have a big advisory board of clinical experts of various diseases and business experts to really scale our business. We're raising $1 million covering the growth costs for the next 2 years. We've already secured $500,000 to grow the staff, grow marketing, and online sales so that you can also purchase a clinic kit online. We're asking for $500,000 more in grant or soft debt to increase the staff for the pilots that we're running at work sites and to increase the staff for analytics sales as well. And by doing that, we can reach over 1 million patients in the next year. We hope you will join our journey to eventually improve the health of over 1 billion people. Thank you.